More than a year after a drunk driver slammed into an Austin ER, killing herself and seriously injuring 5, including all 4 members of the Bernard family.
Why did it happen to us? Why did we survive this?
There's growing bipartisan support for a proposal here at the Texas Capitol, sparked by our investigations aimed at preventing other disasters across the state.
It's a common sense bill.
Democratic State Senator Royce West says his bill will save lives. How much of an influence did our reporting and the Bernard family story influence your decision to file that bill?
Very much. It really did. You end up being, I guess you could say, vessels of information for us to look at legislation.
Senate Bill 660 expands what the Austin City Council approved in December, requiring the installation of crash-tested security barriers called bollards at hospital entrances statewide.
I would be very surprised if it didn't pass.
Will this bill get a hearing?
Yeah, definitely will get a hearing.
West's bill was referred to the Senate Health and Human Services Committee.
That's another common sense approach.
Chaired by Republican Senator Lois Kolkhorst, who wants to work with hospital groups on new safety standards.
We talk a lot about patient safety. You certainly don't want to have to think about walking out of an ER or being close to an ER and having someone crash through it.
We found more than 400 instances in the last decade of vehicles crashing into or at medical facilities across the country.
We also took our findings to Republican Senator Bob Hall, who sits on the committee and has worked on patient safety legislation in the past.
It would be different if there were just an isolated incident someplace that this happened. But as you pointed out, there are enough of them now to say this is a major problem.
I am literally in shock.
Dr. Ray Callis is president of the Texas Medical Association, which advocates for 60,000 Texas physicians and medical students. He didn't know the problem was so broad until we told him.
If we can even save one life and we can make sure it's safer for not only the people that are going to the hospital, like our patients, but also all employees, I think it's a good thing to be doing.
While TMA doesn't have a bollard policy or an official position on West's bill, Callis says it needs to be considered.
I would definitely be in support of anything that will improve patient safety and physician safety and hospital safety for all Texans.
Similarly, the Texas Nurses Association tells us elected officials should explore all options that may create a safe environment for all healthcare workers and those receiving care. But not everyone is on board. In a blog post at the start of the legislative session, the head of the Texas Hospital Association, which advocates for more than 85% of the state's acute care hospitals, called the bill misguided, writing, "A mandate for bollards is an unreasonable administrative cost burden that could impact access to care and the cost of care for many Texans. It's crucial that hospitals be allowed to independently assess safety measures on the needs of their communities."
Whenever I travel over the state, I see some with bollards, some without.
But absent any local, state, or federal requirements, our investigation found a patchwork system where some hospitals do not have bollards, or like St. David's North Austin Medical Center, only installing them after a tragedy like last year's.
If they aren't going to do it, then we in the legislature have a responsibility to protect the people of Texas.
St. David's is currently facing $1 million lawsuit for not having bollards. The hospital system says it doesn't comment on litigation or pending legislation, but previously told us it will work with policymakers to ensure compliance with any new legal or regulatory requirement that may be passed. At the Capitol, Matt Grant, State of Texas.
Well, thank you, Matt. You can catch up on our year-long investigation now before this bill progresses through the session. Just look for the Preventing Disaster links on our website in this week's State of Texas story.
Why does Texas need this legislation?
We need to make sure that injury and harm does not occur.
More oversight could be coming from the Capitol surrounding Botox injections in Texas. The bill and new statewide guidelines now in place.